Good, happy Wednesday morning, December 23rd, 2020. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Wednesday morning, so let's begin. First up, we begin with COVID-19 hospitalizations rise as vaccines continue to be distributed in New Hampshire. Governor says no need for new restrictions at this time. Let's take a listen to that video from WMUR News 9.
This season, consider COVID-19 testing from Quest. Trusted by millions of people like you. Order online. Select from
24,200 doses of Moderna vaccine arrived in New Hampshire today, days after the FDA cleared it for emergency use.
Like other vaccines, people who receive this vaccine can expect to have pain, redness, and swelling at the injection site. A smaller number of people may feel tired, have muscle or body aches, fever, all of which will resolve quickly.
Dr. Beth Daly with DHHS says those are signs that your body is responding and developing the antibodies. About half of those Moderna shots will be distributed to state hospitals, inoculating the highest risk healthcare workers.
And about half are going to be used to launch our state-run fixed vaccination sites, as well as our mobile teams, which will be run by our regional public health network partners.
Those sites are set to open at 13 locations next Tuesday.
These sites will begin vaccinating our high-risk ambulatory care providers, those healthcare providers that aren't working in hospital settings, as well as our first responders.
Another 8,875 doses of Pfizer vaccines were also delivered this week, primarily directed to the federal long-term care facility pharmacy partnership program that started this week.
Between CVS and Walgreens pharmacies, they've begun vaccinating a number of different facilities across our state this week.
The state has been told to expect about 9,000 doses of each of those two vaccines for a total of 18,000 over the next few weeks, each week, and that is subject to change. On Monday, the state will start publicly reporting how much each hospital is getting of the vaccine and how many vaccines have been distributed. In Concord, I'm Charisse LeClaire, WMUR News 9.
Okay, and there you go on that video and that report. And now let's take a look at New Hampshire COVID information, new updates and data. And here is a look at that information for all of you right now. There are 38,008 number of people in New Hampshire have tested positive for COVID-19. 18,197,351 number of people in the United States have tested positive. 656 number of deaths from COVID-19 in New Hampshire. 889 number of people who have been hospitalized with COVID-19 in New Hampshire. And 285 number of deaths from COVID-19 in the United States. And now let's take a look at this map of New Hampshire where current cases of COVID-19 are. In Nashua, 509. Let's take a look at this map of New Hampshire where total cases of COVID-19 are. Nashua, 3440. And now let's take a look at these three charts here. Let's start with the first chart here, new cases each day in New Hampshire. In the purple, daily new positive COVID-19 cases, orange, new hospitalization, and red, deaths. And let's take a look at this chart here, current cases. In the purple, total current COVID-19 cases, in orange, current hospitalization. Let's take a look at this chart here, total cases. In the purple, total positive COVID-19 cases, orange, total hospitalization, red, deaths, and blue, recovered. Let's take a look at this chart here, positive PCR test rate, positive PCR and antigen test rate, and daily PCR test. Let's take a look at this chart here, age group of cases, and female and male of cases. Let's take a look at this chart here, infections, hospitalizations, and deaths. Let's take a look at this chart here, deaths, percent of New Hampshire population, race/ethnicity of cases, and hospitalizations. There are minor common symptoms: fever, lack of smell, cough, chills, difficult breathing, nausea, vomiting, and diarrhea. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. United Way for Greater Nashua seeking volunteers for COVID-19 vaccination sites. No medical experience required. Let's take a listen to that video from WMUR News 9.
This year, I got the most unique gift for the holidays. My wife gave me a Flame Air Club membership.
This is a way to make a difference in a way that might never, frankly, come up again.
The United Way of Greater Nashua is looking for volunteers to help people at COVID-19 vaccination sites.
If you're looking to make a difference in your community, this is a once-in-a-lifetime call to arms to support Greater Nashua in our efforts to stay healthy, safe, and strong.
No experience is required, and you won't be doing any medical work, but you will be helping in other ways.
Could be anything from traffic control to walking around with a clipboard, making sure people are registered.
Foreign language skills are also particularly helpful.
Nashua is a very diverse community, so in particular, Spanish and Portuguese are highly desirable languages. If somebody has those skills, that helps a lot.
In addition to helping vaccination sites run smoothly, the nonprofit is also delivering gift cards to hospital workers, and they're helping students with remote learning by handing out laptops and mobile hotspots. They also run pop-up mobile food pantries and more.
As of today, we've, for example, distributed almost 200,000 face masks in Greater Nashua through our efforts to keep our community safe. So lots of ways in which you can pitch in with the United Way to make a difference in our community.
You will have to pass a background check, and if you are a retired medical professional, the United Way says they can help connect you to the hospitals. In Manchester, Jessica Moran, WMUR News 9.
Okay, and there you go on that video and that report. Shaheen Hassan say New Hampshire expected to receive estimated $2 billion in new COVID-19 relief funds. Funding expected to include $614 million in direct payments and $259 million for education and $183 million for testing and tracing migration. Let's take a listen to that video from WMUR News 9.
As you make plans this season, consider COVID-19 testing from Quest, trusted by millions of people like you. Order.
New Hampshire will bring home $2 billion of the $900 billion pandemic relief package, according to the nonpartisan Congressional Research Service. New Hampshire's share of direct stimulus payments tops $614 million. That's from the $600 checks for Americans earning up to $75,000 a year and dependent children. And $685 million comes to the state for the 11-week extension of unemployment benefits. The $300 weekly boost raises the average benefit from $274 to $574.
A lot of really good stuff in there that will handle some of the costs that right now states are bearing. The federal government is going to come in and support specifically around the COVID pandemic.
New Hampshire will receive $200 million for rental assistance, close to $260 million in education relief funds, nearly $220 million for COVID programs like testing, tracing, and vaccine distribution, $5 million for funeral assistance, $6.8 million set aside for airports. And in the final days of 2020, the deadline for states to spend all the federal CARES Act funds already approved has been extended another year.
It is frustrating. I think a lot of people share that it did take so long for this to get done. One thing they were touting was the flexibility that states now have with CARES Act funds. They have passed that flexibility with a week to go. So most states have actually spent all of their CARES Act funds.
Jean Mackin, WMUR, News 9.
Okay, and there you go on that video and that report. Moderna vaccines disaster in VA healthcare system. Veterans asked to wait for guidance. Limited supply, but providers are excited. Let's take a listen to that video from WMUR News 9.
This year, I got the most unique gift for the holidays. My wife gave me a Fleet Air Club membership.
It was like Christmas. I felt like a kid when I went up there.
Veteran and provider Dr. Evan Kelly among the first to get the Moderna vaccine at the VA healthcare campus in Manchester.
My first thought, aside from Christmas, I'm getting goosebumps right now, frankly, is the safety of my brothers and sisters. My brothers and sisters that are veterans, my brothers and sisters that I work with, and then by extension, their families.
Excitement despite the limited first supply.
My pharmacy staff were just so excited because so many people here at the VA have done whatever's been asked for them over the past 6 months. We've deployed staff to different areas, nursing homes, to help.
The state's VA healthcare system employs over 940 people. Following CDC guidelines, priority for this delivery given to healthcare workers and residents at the Community Living Center, a residential nursing facility on the Manchester campus, extending to high-risk and ancillary workers in the system.
We have lab workers, we have radiology, we've got all these departments that help support either testing for COVID and all those departments that you at first might not think are essential, but they really help keep the hospital running.
As for vaccinating the nearly 28,000 veterans they care for in New Hampshire, the VA is asking them to be patient. They say they're working on a process and some guidance will be available soon. We're live in Portsmouth. Jennifer Crompton, WMUR News 9.
Okay, and there you go on that video and that report. Thank you for watching this morning edition of the Riley King Newscast right here on the Riley King Network. I hope you all have a great rest of your day, and I'll see you back here later on today for another newscast. I'll have a news report coming up in a little bit. Goodbye, everyone.